and welcome to Apply Eyelash Extensions session number 2. I'm sitting with Valentina Lacastro and we've had a bit of a break, so we're going to move on to mapping and client consultation. So I'll just put this out of the way for a second, Valentina. Alright, so client consultation, again, you're following along with your training manual here. We're going to follow up with our patch test results, which I've still got in my arm. We're going to refresh on the different eye shapes. We're going to do our client consultation. We're going to set up our workstation. We're going to lash cleanse and prep to start the mapping, iPad application, and then we're actually going to get stuck into the mapping techniques. So, the importance of a consultation. Can you tell me what's important and why would you do a client consultation? Just before any treatment, not just lash extensions.
So you know what they want done. Or
Okay, but I've booked in for eyelash extensions. I know what I want done.
I don't know.
Okay, so the importance of a consultation, it gives you the opportunity to get to know what your client's expectations are from booking the appointment. So she might come in and book an appointment for an eyelash extension and she wants mega volume, okay? But she's got really small eyes, really fine lashes. Do you think that mega volume is actually going to be the way to go there?
No.
That's right. So her expectation to what her outcome is going to be completely different. If you let her know and make her aware of that change in her expectation, the shock value when it's finished, knowing that she didn't get what she had booked in for, she's aware that, you know, her expectation is unrealistic and it has to change to balance with the outcome. Okay, it also then puts the ball back into your court for you to decide whether you are going to perform that treatment or not. Okay, personally as a therapist, if I don't believe and fully back the treatment that I'm going to do, I prefer to just step away and refer them on to someone else. Okay, I'd much prefer that than actually have that client come back at me because I didn't give her the expectation that she was actually wanting to achieve, even though it was unrealistic in my opinion. Okay, so the other thing is discussing allergies. So it gives you the opportunity to talk about different allergies that she might have, any issues that she's had previously, and what she wants out of the actual treatment, out of the clinic. You know, is it just for a one-off special occasion? Is she wanting to maintain these eyelashes for whatever reasons? It also gives you the chance to identify her eye shape. Okay, so while you're doing the consultation, just as I'm looking at you now, you can actually assess their eye shape and sort of picture in your head what, automatically have that actually moving and flowing, so that you're one step ahead of just projecting what you would like to see as the best outcome as well. And you also need to explain aftercare instructions. Okay, there is a bit of maintenance involved with eyelash extensions, and you just need to ensure that the client is prepared and understands that it's not something you're just going to put on and let them go. Okay, because if you're not maintaining them, if you're not cleansing them, if you're not getting refills, then there's a lot of other issues that can come about from that. So can you think of any other issues that might arise from poor maintenance of the eyelashes?
You could get infections or styes or something.
That's right. So that goes all the way back to what we discussed in the beginning. It then becomes a contraindication. Okay, so you might perform her eyelash extensions and then she doesn't maintain them, and she comes back in 2 or 3 weeks' time for her refill, and she now has blepharitis, or she has lice and mites. Sorry, I can't perform that treatment. You'd recommend full removal of the lashes. You then need to recommend different aftercare to help strengthen and help actually treat the issue. And basically both of those 3 and 4, the blepharitis and the lice, generally is a poor hygiene. Okay, so they're actually not maintaining or looking after it. You also need to think about the aftercare in the respect of, is she an active person? Okay, is she out at the gym sweating every day? Because if that's the case, she's going to have to wash them more often, and B, which will mean she'll need to get a refill more often. So that's that maintenance is she's looking at every second week to get her refills done. Okay, so there are a lot of different things that come into doing your consultation and your preparation. It also helps you get set, like I said, set in the frame of mind of what their expectations and outcomes could be. So if you just want to read through those, the client consultation sheet. So what should a client consultation sheet, what elements should a consultation have?
Asking like what kind of eye shape she has.
Would you ask her what kind of eye shape, or would you be the one identifying that?
I'd be the one identifying.
That's right. So maybe you could ask what style she wants. Would you just give her what she wants?
No, I'd ask more in-depth questions.
Okay, but if I said, if I had a monolid and I wanted mega volume, would you just give me mega volume lashes because that's what I want?
No.
Okay, why?
I'd recommend something else because it might not suit the eye shape.
Okay. Alright, so you've got what eye shape does she have, what style does she want, what style do you recommend, does she wear glasses? Why do you think glasses would affect?
Because the lashes could rub on the lens and it can cause them to lift more.
That's right, so wearing glasses is actually going to affect the length of lashes that you use for the extensions. Obviously, when it comes to this, does she wear glasses? You would actually ask her to put her glasses on and you would have a look on a side angle to make sure that the glass is actually sitting far enough away from the lashes, otherwise you're going to get lots of irritation there. Why would wearing a lot of eye makeup make a difference?
Because you're using brushes and when you go to wash it, all the eye makeup off, you're like scrubbing it really hard with your hands and that can cause the lashes to fall off.
That's right. So it affects the lasting, so how long she can go between refills. It also affects how often she needs to wash them and with what, okay? So if she's wearing a lot of eye makeup, it's really, really important that she cleanses them properly, and it's really important the type of eye makeup. So you need to avoid oily type eyeliners because the oils and different eye makeup products can actually dissolve the lash glue, and you will actually see the lash glue. The extension has fallen off and generally a little blob of glue is left on the lashes. That's when you know that they're using an actual product on their eye that is dissolving the glue prior to it naturally shedding itself. Okay, and it gives you the opportunity to tell her about refills and how often she needs to have them done. And it gives you an opportunity to talk about the maintenance. Again, if you've got someone who does surf life-saving and they're in the water every day, you need to make them aware that although they can have the lash extensions done, there's a possibility that their maintenance is going to be more often. Okay, so let's go back to our patch test and see how we're going. We got any irritation there? No, that's excellent. So we can have a look at our patch test result page. Okay, and just tick off on that. Do we have a reaction to the glue?
You want me to put yours in the bin?
Yes, please. Thank you.
No.
No. And do we have a reaction to the little iPad number 2?
No.
And did you have a reaction to the alcohol wipes?
No.
And did you have a reaction to the tape?
No.
Excellent. So can we go ahead and do this?
Yes.
Yeah. Okay. Excellent. So if you flip that over, you'll see on the other side is the client consultation. I do have a spare one that you can pop into your training manual as well. So basically we have it's just like a template, so it's just a sample, and our client's name is Sonia Danaher. And yes, Sonia wears glasses. What else do we have here?
They want a natural enhancement.
Yep, okay, what else?
They don't like their natural. Oh, they don't like to wear eyeliner and that.
Okay, so
they can do it.
Alright, so, and we're actually going to assume, just as part of the training, that this patch test done was performed on Sonia. Okay, so she's had no allergies, that's fine. And what sort of eye shape have you identified Sonia to have? Remembering she wears glasses as well, so we need to identify an eye shape for her, and then we need to identify a mapping style.
Okay.
So we can go back to the manual. And you can just pick one because you're actually going to map all 3 different styles. So,
Okay.
but for the sake of Sonia, we need to identify an eye shape for her.
She has almond eyes.
Almond eyes. Okay. And what is going to be the
They're close together.
what is going to be the best eye shape? Sorry, the best mapping design for someone with almond eyes.
Possibly either a cat eye or a kitten eye.
Well done. Okay, so your almond eye is it's funny you've chosen that because it is actually the most natural and common eye shape. And so to best enhance that, the cat eye is actually perfect, or the kitten eye. So you've done really well there. Okay, so let's pop that aside. But you do have to decide one. Is the cat eye or the kitten eye for Sonia?
We'll do the cat eye.
Okay, so you want to keep this one open up, and we're going to grab our practice mats. I'm just going to, with you and guide you, we're going to set up our workstation. So going back through the briefing notes, you have actually already completed the short course on how to set up your workstation for eyelash extensions.
Yeah.
So you know all the elements that you should have at your station when you're performing an eyelash extension. We're not actually going to need all of the products here today because we don't. It's a mannequin, so we're not actually going to need all the elements. We're not actually performing an eyelash extension at this stage. So, but what we are going to need are tweezers. You go through your little black box of goodies there. I have got my eyelash extensions.
So we have a tweezers. We have our tweezers here.
Okay, so what you're going to need are your tweezers. We're going to need the glue, the lash pads, glue pot. So we've got the glue pot. We're going to need the alcohol wipes, isopropyl, which is here. Yes. Lip wands, the lip wands. Yep. And we're going to need spoolies,
Yep.
tape. We're going to need, what else have we got here? Eye drops and sanitizer spray and disinfectant spray or wipes. Eye drops are down the back there.
Eye drops.
Yep. The glue plate. Okay, so we're actually going to be using the pots today. We've got towels, we've got that, we've got hand sanitizer here, and we're going to need the little fans, 2 different types of fans. Okay, well done. Okay, so when it comes to hygiene, health and safety, so sterilising the equipment is very, very important. So it's a good idea to have some disinfectant wipes on hand where you're actually wiping over your tools, tweezers, your mirrors, and your bench tops, and then you can actually spray them with a disinfectant spray and make sure they're dry completely before you put them away. Wearing a face mask is important, especially if you have a cold. Okay, so it also helps you stop breathing on your client's face because you will find that you're actually sitting quite close to them. washing your hands is super important, and anytime you put your tweezers down and go to do something else, whether it be get more glue, whether it be get more lashes, restock, try and use your hand sanitizer, because remembering you're actually very close to their eyes, so you don't want to be passing on infections. Again, coughs and colds, best to reschedule your clients if you do have a cough or a cold. And you also need the bed head, like disposable sheets. So you can actually buy them in rolls like this, where you just pop that over the actual pillow or the bed, and that's disposable, so that's just protecting. When it comes down to health and safety, ensure that the room is well ventilated. Again, the glues the fumes can actually affect some people, so ventilation is important. We've done our patch test. We've got our material safety data sheets. Again, we've got ventilation twice there. Okay, food awareness. Why would I say food awareness?
Because crumbs might drop onto their faces.
Okay, so you've got crumbs dropping onto their faces, but you've also got, you're working very close with them. So you've got your breath breathing onto them, and you've also got your hands. So if you're out there and you're eating boiled eggs or whatever, and you're not actually using proper hand hygiene, if they're allergic to eggs, you're going to have an issue. Okay, so you can, the other option is to wear gloves as well. When it comes to work health safety, a good stool is very important. And if you have a look at the stool that you're sitting on, it's very ergonomically shaped. So it actually forces you to have good posture. So it does force you to actually sit up straight. And it is height adjustable. So you can actually have both feet on the ground. And the treatment bed, the electric is the best option because it helps you determine the right height for yourself. Different clients will actually require the bed to be at a different level. Again, in the chair and the bed, ensure that your posture is correct. It's best to ensure that your hair is tied back like that as well, so you've got good there. And just try not to wear too much loose clothing around the arms because you are around the face, and you don't want any sleeves or anything dipping into the glue as you're going through there. So, quick eye shape refresh. We've got the almond, hooded, deep set, wide set, and close set. Basically, these eye shapes are just condensed with the ones that are in your training manual. So we've got the protruding eyes, which you've got close set, wide set, deep set, hooded. So they're all like the sunken eyes and things like that. So it's just a case of getting that right. Oops. Is that going to open for me? Okay, so we're going to watch a quick video.
We are going to learn how to make a lash map. We do this for a few different reasons. First is to make sure each eye is symmetrical and has the same shape as the other. Another reason is to keep your work organized. Then, as we work, we can see which section we need to work in and what needs to be done next. We don't want to get lost. I lash map on every single client. It doesn't matter how good you are, as time goes on, lash mapping will help you lash faster, be more efficient, and have symmetrical work. Alright, to begin, I first ask the client what shape they are wanting. Cat eye, natural eye, or whatever shape they decide. I use their natural eyelash shape and length to help be my guide. I'm going to do a natural mapping on this eye as an example. I'm going to lash map right onto the gel patch. I'm starting on the inner corner and I'm going to draw a short length like 8 millimeter. Next, I'm going to come across and I'm going to match what I drew on the other eye. The eyes are now symmetrical and I know exactly where I'm going to place the 8 millimeter lashes. Next, I'm going to draw 9, 10, 11, and then back down to 10 and 9 to follow the natural lash shape. That looks great. Now I'm going to do it to the other side and match what I drew to make sure they are symmetrical on both sides.
Okay, so looking at that map design, if you look at your training manual, what shape do you think that she's mapping there?
More of a maybe like a doll eye or a kitten eye.
Okay, so it's not a doll eye, because the doll eye, as you can see from this one here, where the eyebrows are, it's actually starting, the main length is at the middle. Okay, so it's not quite the doll eye. What else?
Could be. I'm pretty sure it's more of a kitten eye because it arches more near the middle of the eyebrow.
Okay, that's right. So as you can see through here, the highest peak is at the where the arch is of the eyebrow. Okay, so if you had a more cat eye, again, that peak here, this number 11, will actually be on this side here, because you're actually trying to drag it out and open a little bit more. So well done.
This is how to draw a lash map.
Okay, so that's the basics of lash mapping. Okay, so the key to a perfect lash extensions actually is lash mapping. So using a map for every client, and whether they've got a full set or whether you're doing a refill, it can actually help guide you and keep those lashes balanced on both sides. So sometimes, you know, you're looking at an hour's treatment, so even if you lose track of where you're headed, you've always got the map to guide you back to where you should be. Okay, so it helps your treatment flow, so you're not actually having to stop. Once you've done the map, you can actually set up your lash plate and have all the lashes that you need prepped and ready to go. So it helps for a seamless treatment plan, so you're not stopping and starting all the time. Okay, so the first thing to do is cleansing the lashes. So when you're actually cleansing the lashes, let's get this, and I get you to watch me. So we're just going to perform this on one eye for the time being, because, you know, we are just going to practice mapping. Oopsie. Oopsie. Okay, so we'll get two for you and two for me, and I will show you how we're going about this here. We don't need the lip brush. Okay. So you're actually just going to dip, and then top and bottom. Okay, so you place one of the wands at the bottom of the lash and one on the top, and you very gently hold the bottom one firm and roll the top one across to the edge and right to the tips of the lashes. Okay, so you're not pulling it firmly, but you're just rubbing it enough so that you're actually wiping off any oils left behind. These can then be thrown away. So you should have your dint handy. Sorry, thank you, love. And then you have two different types of fans. So you have your little USB chargeable. So you're going to dry that off because it is isopropyl alcohol around the eyes, or we do have the manual puffer air, okay? So that's just going to dry those. So that's how we prepare the lashes to cleanse off any oils and moisture that is on. Okay, so I have a quick question for you. Are you going to be looking at your client like that when you're putting on your lashes? When you're putting on your lashes?
Not sure.
I don't know. There we go. Okay. So you might find, is that a little bit easier for you to cleanse those lashes now that, oops, the position is right? Yeah. That's okay. Okay, so just show me that again. Perfect. Perfect. I'm going to dry them off. It's upside down. Okay, and or you can use a little buffer. They can actually be quite soothing. So from here we're going to apply, we're actually applying mapping pads to our mannequin today. I've done one, so I'll let you just watch me do one on the other side.
Oh.
Hang on a second.
Yeah.
Oops, okay. That one. So when you're applying, and this goes the same with applying, we're going to use these in place of the iPad. So, but when you're applying the iPad on your client, you want to come underneath, and using your thumb or your ring finger, you can actually slightly lift the upper lid, and then that way you're actually placing the iPad very, very close to the lash line. On the bottom lashes. These ones here, we're just going to go underneath the lashes and get that nice and close up to the lash line. Okay, so when you have a situation like this, where it is crinkled and it is crimping, it does actually happen on clients as well. What you can actually do is just cut little slits on the iPad, and that just allows for the iPad to actually fan across the face, and you don't get any crinkling happening, so that will sit nice and firm there. Okay. Okay, so once you've placed the iPads on, what you want to do is get a spoolie. There you go. And you want to brush the lashes down. So brushing them down just pops them in the correct position, makes them straight, and if they're having a refill, it actually combs out, and you'll find that any loose lash extensions can actually just you can actually jiggle them off as you bring that on. Not too high.
She's got a few little lashes under there.
Okay. So it's, yep. Okay, so you've got a coloured pen. You had a coloured pen in your...
Here.
Yep, okay, you can use that one. I've got a coloured texture. Now we are going to map according to the almond eye, and you wanted to do the cat eye on that. That's it there. Okay, so starting from the inner corner, just as we saw in the video, we're going to actually just map one side, and again we're going to start off with an 8 on the inner corner, and we're going to do the same on the other side. So we're going to start off with an 8 on both corners, and that way we're balancing and evening. Yeah, all that, and that's 8's going to come all the way up. Yep, to the next cluster. Yep. So I'm actually going to put 8 for a little bit longer in the middle, and then we're going to move it into a number 9 lash. Okay, so it's very slowly and very gradually getting longer in length. We're going to go up to a number 10. Okay, so that's the middle of the lashes, and then according to this, are we going to start, do we start peaking it now to the longest length?
Yeah.
Okay, so the next one is the 11, because we're going up in length. We can stick with the 11 all the way, and then we're going to scale it back down to a 10.
Yep.
And finish off with a 9 on the end.
Yep.
Yep. And a 9 on the end. How'd you go with that?
Great.
Good. Okay, so now what I want you to do on your own, you've got another mannequin to work with there. So I want you to apply some more, another iPad, and I want you to map a doll eye. So the other thing to remember is, although we are working on a mannequin today, we do need to try and treat that as a real client. Okay, so we're doing a doll eye.
Ow.
So with the doll eye, it starts with just a very small section for the inner corner, and it starts to really peak up quite quickly.
Like that?
Okay, with the doll eye, I would actually, you've started your 12, I would actually extend the 12 a little bit longer for a wider section.
Yeah.
And that's because you really want to lift the middle of the lid and open that up. So you want to create that length right across the middle. And, yep, and then you can bring that back down. Well done. Okay, so how are you going for understanding there? All good?
Do you have a tissue I could borrow?
Yes, of course I do. Well, you can't borrow it, I don't want it back. But you can have some tissues.
Thank you.
How are we going there for understanding? Good? Alright. So we've completed our session 2 for today. We're going to have another quick break, and then we're going to come back and we're going to head on to session number 3, where we're actually going to start gluing on the eyelashes. So I will get some lights and set up. Again, off you go if you need the bathroom. Feel free to make yourself a cup of tea or coffee. And there is a cafe just down the road. We'll be back in about 15 minutes and we'll carry on. Thank you.